A very good morning to one and all. Honorable doctors, directors, Dr. Pratik, Dr. Avinash, and Dr. Rahul, and all dear audience, HODs of various pharmacy colleges, students, and I hope some medical students are also here, to the administrative and non-administrative staff, press and media. My hearty welcome to Prathima Cancer Institute. So introducing myself, I'm Dr. Harshini. I'm interventional pulmonologist. I'm a visiting consultant here in the Prathima Cancer Institute. So I pursued my pulmonology here and pursued my interventional pulmonology in Malaysia and Italy. Now I would like to say one thing. At the end of my talk, if you have any queries, you can raise your hands and ask the queries. So I'm here to answer your questions because as Avinash sir said, it's a two-side communication and we should keep it as a two-side communication. So before that, I want to say only a few points. Let me give some more time to other eminent speakers here. I think many of you are thinking that, or you might have thought before that you wanted to be doctors, isn't it? How many of you wanted to become doctors before choosing this or while choosing BPC? All of you? Great. Then I think it's an honor to all of us who are sitting on the dais. And this is how we make ourselves happy at times. But welcome to medical field, because medical field is not just about doctors. It's about pharmacy, it's about B-pharmacy, and many more staff. Like, you know, even because the problem in India is the doctors are less in number, and we need the support of other branches to help the doctors. The reason being, if we want to do an awareness camp, if we want to provide awareness to many more villages here surrounding, we cannot do it because you can see such a big institute is having only limited doctors. Of course, they are relevant, but they're only limited doctors. If we go out and start doing awareness campaigns, then who is going to treat the patient? So there's a reason being the numbers being limited. I request all other people, like let it be pharmacy, PharmD, okay, or biotechnology, whatever relevant allied health science branches are there, I request them as a part of NSS activities from your institutes or as volunteering with the help of your HODs who are very much experienced in this field to go out and do awareness campaigns. So before you going out and doing certain awareness campaigns, you should be knowing what is what. Because many times, even among doctors, for example, if you go deep and ask me about gynecology, I might not be knowing depth of it. But it's not required to treat a regular patient, okay? At the same time, when doctors themselves have discrepancies, naturally allied health sciences, they might not be knowing screening or awareness regarding cancers. So each branch, each specialist is here. So they are talking about their own specialization. Like that, I want to tell a few words about lung cancers. And most importantly, apart from lung cancers, I want to say something about carcinoids. There is something called carcinoids. Why I want to mention this as the first point is because this is mostly seen in the youngsters. Most common age group being 20 to 40 years, and most common being females. So now, you should know there is a difference between a carcinoid and a cancer. At the same time, you should also know that the presenting symptoms are always simple. The same cough, hemoptysis, or bleeding in the cough, or blood in the cough. Okay, there's some sputum, chest pain, breathlessness. These are the common symptoms. When you get a CT done, on X-ray, generally most of the times, it will not be found out. So when you are advised to get a CT scan done, please get a CT scan. Why? Because most of the people, or most of the young patients especially, they deny getting a CT scan. They think that we are getting exposed to more radiation, and radiation is causing some carcinogenic effects in turn. But on advice of a doctor, please get a CT scan done because it can be a carcinoid, and carcinoids are common in young people. So surgery being the treatment, and there is some chemotherapy for a limited period of time. And for most of the common cancers, which I want to create awareness, is naturally smoking, which you know, that if there are smokers and if they are smoking for a long period of time, definitely they are prone to cancers. So you should be always, whenever somebody is coming to you and asking you, because as soon as they see this white apron on you, people will come to you and ask you, so what to do if you have this problem? Sir, I'm having this, or ma'am, I'm having this cough, and I'm having some blood in the sputum, I'm having some breathlessness. You should just not think it to be some asthma, COPD or something else. You should first ask, do you smoke? And from how long you're smoking? How many packs you smoked? So you should answer this. So many people say, I used to smoke before and I just recently quit it. So recent means when? Yesterday or today? Because that's one more biggest thing. Most of the people say, I quit yesterday. So you should be very keen on these points. Even in non-smokers, some people say, I do yoga every day. There are a lot of patients who do yoga every day, who have a proper diet, who have a healthy lifestyle and still have cancers. So what I want to make a point is, it's not just smokers. In smokers, you should have the predictive percentage should be 99%. But if they're non-smokers, even then 50 to 60% the risk of cancers are there. So please don't avoid non-smoker population also. Immediately take them to an appropriate consultant, whoever is, or advise them that go to a pulmonologist, go to an oncologist, whosoever is concerned. So the first point of contact being a pulmonologist, let the pulmonologist do the CT scan, let them investigate, and then take to an oncologist for further treatment if it's a cancer. And the second thing we would like to tell is, not just diagnosing, it's also about preventing. So how to prevent? You know, it's only a simple thing. Stop smoking. How many ever times we tell it's going to be the same, but still. So, and this, people say that we don't smoke BD, we smoke some refined cigarette, or we do hookah, or something else, or these e-cigarettes. So now, the most important point in prevention, what I want to tell the youngsters is, e-cigarettes or hookah are as harmful as nicotine-based cigarettes, and they're as harmful as BDs. So don't think that there were so many papers published that hookahs were not harmful, but now it's a change. Even hookahs and e-cigarettes are harmful, and this vape and everything, all these are also harmful. Any kind of smoke is harmful, so please stop smoking if you have that habit, and please create that awareness also. The next thing is, recently in the COVID, in the last 2 years when there was COVID time, in COVID a lot of CT scans happened to diagnose COVID and to see the prognosis. So during that time, what we found out was, rather than COVID, there were two other things we identified. One, by placing a mask, we couldn't reduce TB. So tuberculosis was one thing which we thought everybody are wearing a mask now, tuberculosis will come down. But it did not come down. Did not come down because it's not just the external thing, but your immunity plays a big role. So the stress and immunity, these two are important points, which are also an add-on point for cancers. The second thing is, when we started doing more number of CT scans for COVID, we incidentally found out many cancers, which are in earlier stages. After this, the US came with a new guidelines. So it came with a lung screening protocol, which is very much new, and they are following it for the past 1 year in US. And I want to tell you that this should be adopted in India also. Because many times I see other consultants telling me that whenever I say get a CT scan done, even though as a screening protocol, let's do a CT scan. Many people feel that, why a CT scan? People are not going to accept a CT scan for screening protocol. People will tell that you are doing it for money. People will tell that you are increasing cancer risk by giving an exposure to CT. But I want to make two things clear. One, these days CT scan are very low dose exposures. So the modern CT scans, like the machines we have, they're all like very low dose of radiation as compared to previous. That is point number one. And point number two is, chest X-rays cannot identify cancers in the stage 1 or stage 2. So everybody, whoever is presenting to us, are all in the stage 4 or last stages. Now if we want to make it, because if we want to treat it, we have to treat it in stage 1 or 2. So if you want to treat it then, what I request is, as soon as your parents they cross 50 years of age, please get a low dose CT scan done. It's not going to, 1 or 2 CT scans are not going to cause much problem. I'm not telling for every viral cough, for every time you have a cough and cold, get a CT scan. I'm not telling that. But once they cross 50 years, please get a low dose CT scan done. And please check if there are any small lesions in the lung. If there are any small lesions in the lung, please go for diagnostic procedures. Please go for biopsies and find out what that lesion is. Just don't leave it like that. Just don't think that, okay, this is there, this is very small, it's okay. Because when it is small, we can identify, we can treat it. But once it progresses, we cannot. Most of the people suffer because they don't know how to get the nursing care to home, and they might not be affordable. The family might not be at home. Previously in India, the situation was different. Previously it was like, okay, there were 2 or 3 family members all the time at home taking care of the elderly people or sick people. Nowadays the situation is different. Everybody are working or studying, going out for their jobs. So the sick people are being neglected. For that reason, the hospice is being established. So you get an awareness what a hospice is, who should get admitted into the hospice, and who should be taking care of them, and how long, and what is the correct point to get admitted into hospice. These things, please get awareness, and I hope you'll spread this word all across your native places, among your communities and your friends group. Thank you so much.